Hi, I'm Dr. Jodie Peacock, one of the co-founders at Exceptional ND. And with me today is a good friend and one of the most amazing naturopaths on the planet,
Aw.
Dr. Olivia Rose.
Hi,
Um,
everyone.
Dr. Rose owns her own clinic, so she's the clinic director at Rose Health Clinic. She also runs a consulting company called O Rose & Co. that does consulting for different natural health product companies and other companies that want to be kind of in the naturopathic medicine space. And she is the founder of Reliv Organics, which is an organic skincare line that she makes here in Toronto. So these are all amazing things, which is one of the reasons that, we were top of mind when we were discussing, which different doctors did we want to interview for our platform. So thank you for taking time out of your incredibly busy schedule to join me to record this today. And
Aw.
I'd love to just hear, just as a starting point, what got you into naturopathic medicine kind of in the first place?
Well, first of all, thank you for that introduction. And you are just equally as amazing. And I look up to you every single day. And thank you for doing this and having this wonderful platform where NDs can stay connected and be inspired. And I'm happy to be here with you today. So what got me into naturopathic medicine would be I don't know, there's so many different influences. One influence was probably my dad. I grew up eating very naturally. I grew up with a whole bunch of basically, we grew up for the first part of my life in an area in Scarborough called Malvern. And our backyard is like we lived on a farm. So we had apple trees, pear trees, peach trees, strawberries, Concord grapes, we had vegetables. And so eating naturally and seeing what food could do for the body was without even making that, not directly making that connection. I just kind of absorbed that. So that became a part of my life. And then everything was coming from a Jamaican background, it was it's very known that when you're sick, you take this bush tea and that tea and that tea to kind of help you get better or whatever. So all of that was kind of part of me growing up. And then there was a direct experience where I was just after puberty time, was starting to feel unwell after a turkey dinner one Thanksgiving, and ended up with hives all over my body, feeling unwell, and went to a dermatologist who looked at me from across the way. He had a big, huge office. He looked at me and he was like, oh, he's got some hives. After I explained to him what happened and how I think it was the cranberries, and I was very verbose as even a 13-year-old, and I was telling him all the stuff. He's like, just take this cream. Well, it's hydrocortisone and you'll be fine. And I was like, oh, okay. I was just really put off by it. And I felt like he didn't even look at my skin, right? And I'm like, what is this? And he's like, no, your food has nothing to do with this. I'm like, what do you mean? I ate this and this happened. Any more logic needed here? Anyway, so that was up to that point, I wanted to be a medical doctor. And I wanted to either be involved in pediatrics or, gynecology. And I had to I started to rethink what my pathway was going to look like from that instant. So I was kind of lost in limbo for a year or two until I was introduced to a naturopathic doctor. And so the next influence would have been him and my sister, one of my sisters, who was into natural hair care, meaning in the Black community, there was a lot at the time of relaxing of the hair, using chemicals, processes. And so my sister was starting this whole movement of natural hair, had a symposium and speakers there. And he was one of them. He was talking about healthy hair from within. And so I was like, wow, what do you mean? So we're making a connection now between what you eat and what you do and your hair. So I shadowed him, followed him all over the place. That's probably very annoying. And I became a naturopathic doctor also just because of him. I realized there's another pathway is what I realized after that. And so I went to the University of Guelph, studied nutrition, and then decided to go to CCM and become a naturopath. So in a nutshell, that's where it came from.
And what has you kind of excited now? I know you've got kind of a lot of things going on. What are you excited to get up about in the morning?
You know what it is right now in this instant? It's the whole idea of collaborating with other practitioners and filling gaps in the healthcare system as an ND. The whole idea of looking at our struggling healthcare system after this global pandemic, seeing how, people are like just strained. These medical offices, you book an appointment, they're not getting back to you. They're missing diagnoses. There's things that are happening, and these are all, for the most part, we have great practitioners out there in the conventional system doing their job, doing what they have to do. But I think it's just a strain, and this is where naturopathic doctors can come in and fill some of these gaps. So the theme this year for me is filling gaps wherever I can. And so the one thing that's making me very excited right now is expanding my practice in more of the virtual space. So the virtual arm of my practice. As of next week, there'll be 18 practitioners working at Rose Health Clinic. And the reason why I did this was because in June 2022, when they're like, okay, let's open up again, we're good to go, it was like crickets. I was like, what's going on? Like, where are the people? So the books were still full, but the brick and mortar was empty. I was like, okay. So number one, when we expanded 2 years prior across Ontario, I'm not going to see my patient that I see every week in Fort Erie coming into the clinic, or Smiths Falls or Ottawa. I'll never see these people ever now, right? And then number two, people are comfortable. The person who's upstairs in the condo who wants to check in with me for 15 minutes is not going to put their pants on and come downstairs to the clinic to see me. They're going to sit, take a break from their days, talk to me for 10 minutes and go back to work, right? So I realized that, okay, what are we going to do? We're going to sell the bit, like, what are we going to do? So what makes me excited now is that I'm filling gaps with respect to psychotherapists. We have a lot of suicidal ideation happening. I've seen a lot of that. I'm seeing a lot of people who are grieving the loss of what once was, deaths in their family, the new normal that everyone's trying to adapt to. And so I've found and connected with practitioners who can help fill those gaps within our community. So psychotherapists, dietitians, people like this to just help support our community and kind of bring them to that next level of wellness and care. That makes me excited right now to be able to offer more at the clinic in that way.
That's awesome.
Yeah.
In terms of kind of that theme that you're talking about, like NDs filling the gaps, like I think this is a big thing that, we've talked about at Exceptional ND. Like, we are the medicine of the future, right? Like, people need naturopaths now more than probably they've ever needed us. So how do you go about filling those gaps? Like, what are you putting in place kind of from a practical standpoint that, people watching can say, okay, yeah, I can do that.
Yeah. You know what? People are more comfortable than ever in spaces like this now. So the virtual space, and they realize that, hey, I can see my doctor like this if I need to, choose to, and I can also gain knowledge from important, webinars and things out there that can help, that are put together by people like yourselves, like me, who have the knowledge to share. And so to have a further reach is how we can fill those gaps. And so getting that knowledge out there, whether it's through social media or through creating different platforms where people can connect and gain that knowledge is great. One of the biggest gaps, there's a lot of areas to deal with, but one of the biggest gaps for me right now is just immune system, immune function. Outside of COVID, people are just getting sick with all kinds of different viruses all of a sudden, right? So what I'm finding is that just spreading that knowledge to my patients, not just, okay, I'm coming in for this, how do I deal with this? But okay, what do you have in your natural medicine cabinet to help you if 2 months from now you end up with a tickle in your throat that could lead to strep throat, right? And so just arming people with what they need to provide that support, doing more blood work, looking at that blood work, looking for suboptimal levels of things, getting on top of those things. That's where I think we can fill, like, in a nutshell, those gaps, is really being on top, helping people to be on top of their health as much as possible.
So being more proactive, preventative.
Yeah, prevention is key right now.
Naturopathic medicine.
Yeah, that's what we do. And more than ever, people are coming in for that. Like I'll see when people book in, you'll see in the description, oh, I'm looking for someone to go over my supplements, make sure I'm taking the right things, or, run some blood work that my doctor doesn't really feel he wants to run. And so people are wanting to investigate and find out more and more about their health. They can better support themselves.
Which I think is where we can help, right? We can help take
Yeah,
that burden off of the traditional system, because obviously it is in a place of crisis.
it is. We're
Right.
very heavily burdened for sure. Yeah.
And then can you tell me, how does Reliv kind of fit into things for you? Like, why did you start that? And how does that kind of work into your practice and your basic schedule, I guess?
Sure. Yeah. Well, I've always so around the same time that I ended up with the hives and after turkey dinner and all of that, it was kind of like I started then it was puberty, you end up with little acne, stuff like that, and kind of dealt with it on and off throughout the years. And there's never really a solution for my skin. It was just always like something that was very drying or uncomfortable, burning, and so along with understanding the role that nutrition and diet played in the health of your skin, I realized that there's something to be said for like when I would dabble and make stuff at home and look at recipes and crush some herbs that my dad had in the garden and put on my face, and they'd be like, what are you doing? When I was doing all this stuff, I realized, oh, my skin likes that. It likes banana peel on it, So like, how can I do to like bring this to life? I always knew that I would do something in skincare. But when I opened Rose Health Clinic, I realized that this was a great opportunity. You have medical estheticians now who can do facials, and then you can make a skincare line to sell and to, use in the clinic. And then the pandemic hit and everything shut down. I'm like, well, what do I do with the skincare line now? Well, maybe this is where we, move to an e-commerce space. So that's where we've ended up now, and as well as in the clinic and trying to get into different retail stores and such. But yeah, that's where it is, and just developing but I think overall it's fun for me. I like to learn about ingredients and how it can affect the health of your skin, and yeah, and I like the idea of just just using more gentler ingredients that are but yet effective, right?
Yeah, absolutely.
Yeah.
So for NDs who are, out there listening to this, would you have any other kind of parting advice for them if they're feeling kind of isolated, lonely in
Yeah.
their clinic? What advice would you give to practitioners who want to feel more sense of community and who want to kind of change that attitude for themselves?
Yeah, I would say reach out. Things are opening up now more and more, like there's so many things out there that you can go to and connect with your colleagues, either online or in person. And, just find a colleague that you can sit down with and have, coffee with, tea with, lunch with. That would be you, my friend. When's our next coffee date? But yeah, like it's just important to reach out, because otherwise you will feel isolated, especially with things moving more into this virtual space. It can get like that. So you just have to reach out and take care of yourself as well. Like if you need to, I'm a big advocate for therapy. So reach out, have therapy, connect with each other, and and things will continue to hopefully get better and better for all of us.
Awesome. Well, thank you so much for that. Any final parting words, tips of inspiration?
No, just keep hope alive, everybody. Everything's going to be all right.
Well, thank you so much for being part of our community at Exceptional ND. I know people often will reach out to you about, skincare things. So absolutely, we'll kind of put that in the notes for you so that they've got, reference of somewhere to go. And with your consulting stuff also, I think that might be something other NDs are interested in, how you got started in that, how you have developed those relationships and that part of the business. So really, we want to create this like amazing sense of community where naturopaths can connect with other naturopaths that are doing things they might be interested in doing. So
I think that's amazing. And and that I just want to add to that, I guess the last thing is, if anyone is interested in like learning about how to start a skincare line, or like, you know, anything, any way I could help or support, I'd be happy to. I'm still navigating everything on myself, but if I can give any advice to help you from making the same mistakes or whatever, I'd be happy to help.
Thank you so much. Always so giving of your time. So we really appreciate it. And thank you so much, and have a great rest of the day.
Thanks for having me.